We're learning more tonight about the ongoing opioid crisis in Hamilton. New information shows there's been an increase in opioid-related paramedic calls and suspected drug-related deaths since 2017. The information was presented to the city's Public Health Committee today, and Sean Cowan was there, joining us live now with more. Sean.
Matt, in speaking with Hamilton paramedics today and a university psychologist, drugs and addiction don't discriminate. However, there are some sectors of the population that are more at risk. Hamilton paramedics say opioid-related calls have been trending up since 2017.
So paramedics are actually well versed in responding to opioid overdoses. We've been using naloxone to reverse overdoses for several decades now. Some of the other things that we've done have shifted towards more harm reduction. So our naloxone distribution program, where paramedics are handing out naloxone to people, whether it's a 911 response or a walk-up response, as well as our harm reduction program, which gives people access to sterile supplies.
Information in a new health report presented to the city today shows opioid-related calls and suspected drug deaths continue to be a significant public health burden. Since January of 2017, the majority of drug-related calls and deaths, 75%, were male, and the average age was 38. In 2023, Hamilton Paramedic Services responded to 964 suspected opioid overdoses. That's about 80 per month. That's up from 2018, when paramedics responded to approximately 450 calls, which is around 38 per month.
So there is areas within the city that we do respond to higher call volumes of opioids, but addictions don't discriminate. So it can be in the street, someone's residence, anywhere really.
Taryn Grider, a psychology professor with the University of Toronto, says,
there is just a lot more stress. And we've seen that in times of stress, the overdoses increase, the drug use just in general increases. If you remember during the pandemic, we saw a big spike in it as well. So right now, the stress that we're experiencing is financial stress.
Grider says there are some people who are more at risk.
People in marginalized populations. So people, minority races, people that are experiencing disability or are experiencing homelessness, people from a lower socioeconomic status group, just in general. I mean, addiction doesn't discriminate by any means, but there are just people who seem to be more vulnerable, people with less education.
And Grider says the more factors a person is facing, the greater risk they have for addiction and overdose. And Hamilton Public Health says there are many supports and programs out there. For more information, you can visit hamilton.ca/naloxone. I'll send it back inside to you.